The images boggle the mind.
People want more. There's so much out there, and there's so many just ridiculous things out on TV and online.
Pictures of people filled and tweaked to the extreme may be the breaking point.
Because they all do have some problem long term.
Take Pixie Fox. At 26, she's already racked up 17 surgeries, the latest removing 6 ribs to shrink her waist. The real-life Barbie doll says her goal is a dream look. Then there's Pixie's partner, Justin Jedlicka. He's been under the knife more than 300 times on a quest to look like a Ken doll. Their looks are far from the outcomes of most normal cosmetic procedures, but they don't seem to mind. Just the thought of turning out even close to these looks can chase some clients away.
The bad tends to scare more people away than the good encourages people to have things done.
Arizona plastic surgeon Shaun Parson sees the trend, the antics of just a few tainting the ideal, especially for the first-timers, those new to cosmetic procedures who may get turned off seeing patients who have gone over the top.
Plastic surgeons, for the most part, we don't see those patients. We don't applaud that being done. You know, we're really trying to have normal soccer moms come in and just make them feel a little bit better about themselves and turn back the clock 5 to 10 years.
For a lot of people, taking that leap into their first cosmetic procedure is a little scary. And then you see an image like this, and it certainly ups the stress factor. But remember, people choose to look like this, and the doctor is in on it. So that's why it's so important to choose your plastic surgeon wisely.
I can't understand some of these surgeons and how they're kind of failing to explain the ramifications of those things long term to the patients.
Rob Whitfield, a plastic surgeon with the Breast and Body Center in Austin, is critical of those performing extreme plastic surgery. He says cosmetic procedures should be about creating natural, subtle looks that age with the patient. He says anything supersized is sure to cause trouble.
If you make an area abnormally disproportionate, there's going to be problems down the road, whether it's with scarring, skin sag, laxity, because people are going to age and things are going to change, and you're going to have to revisit what you did.
Avoiding those mistakes is simple by choosing wisely and creating a natural, youthful-looking you, so subtle that no one will dare compare to the extreme.
I don't want people to go out and be approached and say, hey, you look great, who's your plastic surgeon? I just want people to go out and say, hey, you look great. They can't tell if they've changed their hair. They just get compliments. I mean, that's the best job.
For the Plastic Surgery Channel, I'm Dawn Tongish.